Good now, whenever and wherever this finds you. This video is the fifth in the series of 8 videos that were recorded in Dallas, Texas, in 2019 at an event called America in One Room. This video is mostly about healthcare and the cost of healthcare and the problems that we have from that. So let's go ahead and see what it's about.
Our price of healthcare in the United States is greater than anywhere else on the planet.
They can demand that amount of money for it because you've got to have it to live.
I think the nation needs to determine whether everybody is entitled to healthcare or not.
America in One Room brings a scientific sample of the nation to a single place where they can talk to each other in a civil manner and wrestle with the country's big problems.
We've got enough people.
People were lynched here.
We're closer than you would at first think.
We don't have to settle for the half-dead democracy that we have.
You make me nervous. I'm afraid you're going to put me on the spot.
I was an electrician for 20 years. At the moment, I'm disabled on SSDI.
My name is Sharon Fuller.
I'm Marilyn Harvey.
I'm from St. Johnsbury, Vermont.
From California, Mariposa County.
Sterling, Colorado.
We brought them from all over the country.
Over 500 registered voters to Dallas.
People from all walks of life, all political perspectives.
I'm a registered Democrat, but I like a lot of the old Republican ideals.
Oh, I'm kind of a hardline conservative Republican. Yeah.
I'm sick and tired of the toxic politics.
I'm a veteran and have a disability from the military. And then I was in a severe motorcycle accident. Before I qualified for Medicaid, I couldn't afford health care and nearly died as a result of it.
You notice in the discussions there were almost no references to the political parties or the candidates. They were talking about the big challenges facing America.
Yeah, people are literally dying because they can't afford medication. That's not right. Healthcare is a human right.
We're like prisoners right now to these insurance companies. And I would argue that too many Americans are prisoners to the government when it comes to our healthcare system.
America in One Room is organized as what I call a deliberative poll. Not an ordinary poll, a deliberative poll. An ordinary poll just reflects the public's impressions of sound bites and headlines. Deliberative polling gives you a picture of what public opinion would be if the people thought their voice mattered and really grappled with the issues.
My understanding with Obamacare was it was supposed to capture people who are either self-employed or can't get health care through their employer. Why does this have to be so black and white? I think it should be repealed.
I think the Affordable Care Act should be reformed, not repealed, because it made people get insurance that didn't have it before. And if you run up a huge bill, that was the #1 cause of bankruptcy in this country.
Why is it so expensive? Because if it's supposed to be affordable, why can't it be a couple $100s? Why is it $400 and $500?
We don't have consumers in healthcare, and I would argue that's the problem.
People who are sick are patients. They're not consumers, and they're not shopping the way we shop for oranges or shoes or rice.
Healthcare is a different kind of commodity. If you need brain surgery, you won't put into a search engine, find me the cheapest brain surgeon in my area.
The large pharmaceutical companies and healthcare itself is so expensive that it's created this situation.
The pharmaceuticals, I mean, they're the multi-billion, trillion, gazillion-dollar business. Their goal is to put everybody on drugs for life. That's how they make their money.
The cost of insulin is ridiculous, and it's only because they can demand that amount of money for it because you've got to have it to live.
Our price per unit of healthcare in the United States is greater than anywhere else on the planet.
I think the nation needs to determine whether everybody is entitled to healthcare or not. And I don't think we've come to that conclusion yet.
Yeah, this has all got to be, they got to get a grip on this.
Yeah. Just right here, it says half of non-elderly Americans have a pre-existing condition. What, are they all going to be non-insurable? Who's to say what a pre-existing condition is? Things change all the time, and something that's not a pre-existing condition right now, in my 5 years from now, you might not be insurable because...
Well, it sounds like living is a pre-existing condition.
Yeah, it's okay. I think that everybody here has an interest in bridging that gap between the right, maybe in quote-unquote right and left.
We think that we are in America riven by these great divisions, but in fact, the public is much more open to discussion.
People want deliverance from the toxic polarization of our political system.
That's it. People want deliverance, and it is a toxic environment, and it's done that way on purpose because the powers that want to control and keep things the way they are control the media and the narrative and the propaganda, and the people continue to believe it. And that's why it's so good to get people together and talk to each other, because we each carry a different story, and when the stories are all told, we come up with something closer to the truth. I'm rather inspired by what I see on these videos, and I hope that you enjoy it too, and thank you for watching, and I'll see you down the road.